You are listening to C-Suite Perspectives, a podcast by the Conference Board.
Welcome to C-Suite Perspectives, a signature series by the Conference Board. I'm Steve Odland from the Conference Board and the host of this podcast series. And today we're going to talk about CVS Health and how they're transforming access to primary care, tackling chronic disease management and mental health services, especially for older adults and underserved populations. Joining me today is Dr. Sree Chaguturu, the Executive Vice President and President of Healthcare Delivery at CVS Health. That includes Minute Clinic, Oak Street Health, and Signify Health. Sree, welcome to the program.
Steve, it's a pleasure to be here. Thank you so much.
Everybody who's listening to this is a healthcare consumer. You know, in some ways we're all experts, but in most ways we're not expert at all. How do you view, from a CVS Health perspective, the most pressing barriers that are facing millions of Americans today?
It is a huge problem for our country. And so let me just step back a little bit and not talk about just what is CVS Health's perspective, but just what do we all as Americans have to think about in access to American healthcare. And so I am a physician, practicing physician, but also have the opportunity to lead 3 businesses at CVS Health delivering healthcare for Americans across the country. And when we look at the issues, we see it around cost, quality, access, experience, equity. We call this a quintuple aim. And if we just look at something like access, we have over 100 million Americans who face barriers to accessing primary care. And what we see is that not everyone is achieving the quality outcomes we want on even the basics. Are people getting the chronic disease management and the preventative services that they need? And I could go on and on for each one of those areas of the quintuple aim, but we have a lot of issues across each one of those areas. Again, it's cost, quality, access, experience, and equity. And let me just end with cost. What we see is that $1 in $5 in the American economy is spent on healthcare. We aren't getting great outcomes for that. If we look just at older adults, affordability is a major concern. 1 in 5 seniors spend over $2,000 annually out of pocket, and because of that, they skip care due to the cost. So we have a lot of work to do as a society to make sure that we improve the outcomes in American healthcare.
Yeah, and these problems that you've outlined, cost, quality, access, experience, have been with us for quite some time. I mean, decades and decades. And there have been lots of different policy attempts to try to address these issues. And there have been some improvements, but we still have a long way to go. What are the key things that we need to do differently?
Well, what happens when people can't access care? And I think we all know this. It happens to all of us individually when it's very difficult to get into your healthcare provider. But these consequences ripple outward. What we see is that individuals face delayed diagnoses, poor chronic disease management, higher hospitalization rates. As employers, we see productivity loss, we see higher healthcare benefit spend. And then the public health infrastructure starts to bear the burden as there's more avoidable ER visits and deteriorating health of our populations. So what we need to do is think through on a systems level, what are new ways to finance healthcare? And there's a lot of really interesting things that are happening there. This concept of value-based care, which potentially we can get into, but there's also new care models that we need, which is how do you actually move away from that notion of a one doctor, one patient to team-based care, or reimagine the way that people access care using omni-channel, virtual. So financing and delivery of healthcare are the areas, Steve, that we need to continue to push on to address that quintuple aim that we talked about earlier.
You know, this notion of team-based care seems to be critically important, and we've gone back and forth as a country on this. The country doctor or the family doctor who does it all to then specialists and HMOs, which is more of a team-based, and now we seem to have kind of this pendulum swung back a little bit. But when you look at particularly the older populations, as you say, which is where most of the spending is, it's towards the end of life rather than the middle, you tend to get lots of different interacting illnesses or diseases. And so that interactive team-based management seems to be really important for quality.
Yeah, Steve, I guess if I were to step back for a minute, like we have, as a healthcare industry, historically thought of primary care as one model, doctor patient relationship. But what's really been exciting over the last 20 years is that we've realized that primary care actually needs to quote unquote subspecialize the way that we've subspecialized in lots of other areas of healthcare. So, what do I mean by that? We know that seniors, as you mentioned, Steve, are complex chronic patients with multiple conditions, multiple medications. They need to coordinate across multiple different specialists. One doctor, one patient doesn't work. And that's where team based care really makes sense, where you have a team that's a physician, a nurse practitioner, a pharmacist, a social worker, a financial specialist that all work together to create a care plan that helps figure out what do we need to do for the next 6 months to make sure that you stay out of the hospital and stay healthy. Now, you can't do that team-based care with the traditional healthcare financing model. It requires us to think creatively, and that's where value-based care has come in. And where value-based care, what that is ultimately insurance companies and providers, healthcare providers, coming together to take accountability for healthcare outcomes, costs, and quality. If you can reduce the total cost of care using these much more expensive models of delivering care, then you can share in those savings. And there's also additional bonus upsides. We don't want to incentivize just on managing care because we don't want that to be by withholding care. We want to make sure that you also achieve quality outcomes. And that's where managing to a cost target, improving quality outcomes is the crux of value based care. And we see that really taking hold in Medicare Advantage, where Medicare Advantage insurance plans are partnering with providers. And that's what we do in Oak Street Health, providing that team based care. Now, we also see that that model doesn't necessarily work for somebody who's younger and healthier. What they want is convenient care in their community that can be accessed when they need it, whether it's in person and easy to get to in the community or virtually online. And that's where what we have done at CVS Health is think differently about primary care access. And with Minute Clinic, the model that most people know is that it provides acute care services, but 85% of Americans are within 10 miles of a CVS Health retail location. We have 850 Minute Clinic locations around the country. What we've quietly been doing, Steve, has been expanding the types of services that we're providing in our Minute Clinic beyond just acute care services to preventative and chronic disease management, providing the full suite of primary care services in our Minute Clinic. And as you can imagine, that model really solves a very different problem in healthcare, which is convenient, cost efficient access to healthcare. And so that's what I mean by specialization is that we're seeing that you can't use one model for all patient populations. We're seeing these different models, and we're excited at CVS Health of having something that works for seniors and having one that works for busy families.
Yeah, and CVS has really been a leader with the Minute Clinics and have made an incredible investment in that, not only the bricks and mortar, but also the systems, the processes, the people, the skill sets. That has taken a lot of time and attention and investment. But you're right. I mean, it really does cover a broad age group. I mean, after you get through birth and into childhood, you take it from there all the way up, I would think, almost to seniors in terms of most of the band of care that's necessary.
Yeah, we talk about that as clinicians as cradle to grave, and we want to, as a healthcare system, to be there along that continuum. And so, if you think about Minute Clinic providing care for largely under the age of 65, and then Oak Street Health is a model for over the age of 65, we are there as a company across the spectrum of ages and conditions.
Yeah, really terrific. Now, you also have virtual and home care models, which are relatively new. I think a lot of people in the country began to experience this during COVID when there was a broad introduction of virtual healthcare. But talk about your innovations there.
So, Steve, that's a great question. With virtual care and home care, we think about them as part of an omni-channel experience in accessing healthcare in a way that is much more convenient for the patient and much more centric to what people need. And so with virtual care, what we saw during the pandemic is an explosion of interest in accessing virtual care. What we've seen is that there has been a lot of uptake in acute services being provided by virtual care, as well as mental health services. But it also helps support people with mobility issues or with transportation issues. And it offers flexibility, privacy, and continuity. And so virtual care continues to expand. With Minute Clinic, what we have is both virtual care that is direct to consumer, where across 50 states, Minute Clinic is available 24/7 in providing acute care through virtual services. But we've also launched, in partnership with Aetna, virtual primary care. And with virtual primary care, we offer employers a virtual primary care first experience with the ability to see in person when needed in one of our clinics. And that combination of virtual and physical has been incredibly compelling to employers, but more importantly to their employees in getting access.
It also is a great tool to, provide services to rural customers, which are really hard to get to.
That's exactly right. So we know that we have a provider shortage in this country. So the absolute number of providers, of physicians, is not sufficient for the amount of care we need to deliver. But we also see that there's a geographic distribution issue, and virtual care helps us to fill in those gaps.
Yeah, and it helps to drive down costs too, doesn't it? Because you don't need quite as many physical facilities and it's far more efficient. You think of these issues that you outlined at the beginning, cost, quality, access, and experience as being discrete issues that all need to be addressed individually, but they are collinear, meaning the access piece helps with quality, the chronic disease management helps with cost, all of it is a better experience. And this is how you're trying to at CVS attack this through this multifaceted approach.
That's right. And we didn't even get into home. I'd love to talk about the home as an access point as well. But if just to round out virtual here, what we see is exactly what you've just said. It is both an entry point, virtual is an entry point into the healthcare system when you need acute services, but it also helps supplement the care that you would be receiving on a chronic basis. So it's an opportunity to follow up with your provider and your care team to make sure that you're staying on your path to better health. So virtual has been incredibly powerful in providing omnichannel access and keeping patients healthy.
So go ahead and get into the home element of it. That's new as well, relatively.
So, the home, what we know is that patients are increasingly looking at, and especially seniors are looking at home as an access point for healthcare, in addition to in clinic and virtual. So, those three areas is what we conceive of as omni-channel access to healthcare: virtual, home, and clinic. So, a third business, Steve, at the top of the conversation, you talked about Signify Health. We recently brought Signify Health into the CVS Health family. What Signify Health does is provide in home health evaluations. Over 3 million home visits that CVS Health is providing over the course of the year, where we go into seniors' homes and spend 1 hour with that patient, helping to understand what are their chronic conditions and then help them understand what is the next best step to take in their care journey. And so, why is this important? One, it is very hard to get a 1 hour in depth review of your clinical conditions. And so, to have that conversation helps patients get engaged in their healthcare journey. Two, it is an important part of helping health plans and providers to get that information. And then it is part of the financing mechanism, what we call a risk adjustment. But three, Steve, the most important thing is when you identify risk, you have to manage the risk and help people get better. So, a big part of what Signify Health does is help patients get connected to the next step. And so 500,000 referrals have been made over the past year for patients to get additional services. Let's take an example. we identify a patient with diabetes and they have uncontrolled blood sugars, we then are able to make a follow-up appointment with their primary care physician or their endocrinologist, have them come into a minute clinic, or make sure that we can help them get their medications in a more cost efficient, timely manner or delivered to their home so that they can stay in their path to better health. So it's been really exciting with Signify Health to show the power of the home in helping patients get healthier.
We're talking about innovations in healthcare at CVS Health. We're going to take a short break and be right back.
What does the future of work mean for your employees? How will your company navigate ESG? Will there be a global recession? At the Conference Board, our experts translate the latest research and economic analysis into insights and real-time problem solving for your organization. Membership at the Conference Board provides your team with an assortment of knowledge, from economics, marketing and communications, ESG, public policy, and human capital. As a member, you'll have access to our center experts, member-exclusive events, data and benchmarking tools, and peer sharing that will help you understand the present and shape the future. Consider becoming a Conference Board member today by visiting www.conference-board.org.
Welcome back to C-Suite Perspectives. I'm your host, Steve Odland from the Conference Board, and I'm joined today by Dr. Sree Chaguturu, the Executive Vice President and President of Healthcare Delivery at CVS Health. So Sree, we were talking about all the different physical kinds of approaches, but if you think about one of the key crises in America, it's mental health. And the literature says it's been exacerbated by COVID for a lot of different reasons. And gosh, we could talk all day about that, but addressing these mental health issues is critical. It's critical for employers. It's obviously critical for families and individuals, but it's also critical that the healthcare system deal with this in a cost-effective and a quality manner. Talk about your views on that.
Definitely. This is an incredible crisis in our country, and we need to be able to make sure that everyone has access to behavioral health care, and it should be as easy to access that as physical health care. And this is all part of having whole person health. And so let's talk about how we're addressing this within Minute Clinic. And so, again, as we talked about Minute Clinic, the typical consumer, the typical patient has an incredibly busy lifestyle. It's usually a mother who has two young children, and it's very hard for them to find the time, but also the privacy to be able to get the mental health services that they need. And so, what we have done is develop a national program, and in 49 states, we now offer talk therapy and expanded virtual behavioral health services with licensed clinical social workers. And they're able to help with mild to moderate depression and anxiety and provide that comprehensive support for individuals ages 13 and older. But Steve, here, the point is what we were having a conversation earlier is the value of virtual is the ability to allow us to have providers who can provide private and convenient access to mental health services for a busy mother or father or for children. And then on the opposite end of the spectrum is Oak Street Health. And as we talked about Oak Street Health, this is a primary care model for seniors. And in that team based care model, what we have done is integrated mental health providers into the team based care model. So you'll be seeing your primary care physician, but then also a mental health provider. And that combination in the team allows us to make sure that the mind and the body are integrated. What we have seen is that there is a score for managing and identifying how intense is your depression. We call it the PHQ-9 score. And for patients who are engaged in this comprehensive model, what we saw is that 55% of our engaged patients drop almost 5 points on a scale of 14 in the first 6 weeks of engagement. So that's a lot of numbers, Steve, but basically by having this integrated mental health, physical health model in the clinics, we have seen a substantial drop in depression. And what we also see is that there's about a 10 to 14% decrease in total cost of care as well. And that's because we know that if you're able to better manage your mental health, you're also able to better manage your physical health, and that these things need to be delivered together.
And how do you destigmatize addressing mental health? Because this has just been historical and nobody's ever wanted to admit that they're struggling with anything, and particularly to employers or within an employer plan. I mean, it used to be that if you accessed mental health services within the employer plan, it caused a red flag. Now that's not the case anymore with HIPAA and other controls, but there's still stigma to this.
First and foremost, I think talking about and the importance of whole body, whole person health is important. Our providers talk about the importance of caring for your mind, and that's an important part of caring for your body. I think we're in a very different space now post pandemic. I think during the pandemic, we saw such an increase in mental health needs that there's a much more honest conversation around the need for providing mental health services. But I think these two models that I just described are a really important part of addressing the stigma. One is in the Minute Clinic model is the ability to access it virtually. And in the Oak Street Health model, it's about the fact that your mental health provider is side by side by your primary care team. You don't need to go to another location, but they're right there in the clinic. Just breaking down the barriers, making it easier to access healthcare services, mental health services, is a big part of addressing the stigma of mental health. Are we done? No, we're not. We need to continue to talk about the importance of caring for your mind as well as your body. But these new care models, I think, may go a long way in addressing the stigma for mental health services.
Yeah, we've talked about many facets to this, to healthcare and all of the integrated means that CVS is taking. But a big component of carrying this forward is the digital revolution, the integration of all the tools, including AI. Talk about what CVS is doing with that.
So, Steve, it's a great question on how are we using digital and artificial intelligence in improving healthcare outcomes. And so the way that I think and we think across CVS Health is that digital allows us to increase engagement into the healthcare ecosystem. And with increased engagement comes increased trust and better opportunity to stay on your path to better health and achieve the health outcomes that you want. And so, an example of how we use digital, our CVS Health app. In your CVS Health app, if you go into it, if you haven't downloaded it, I encourage you to do so. And in that, obviously, you can engage with your pharmacy and get your medications and schedule that delivery in a way that's convenient to you. But we also have access to education and resources, as well as the ability to connect to providers virtually through Minute Clinic. And we also have the ability to push messages out. And we do that as we understand who you are and what your needs are, tailored messages that speak to you. So if you're a convenience focused patient and consumer, we'll talk about the times that we're open. And if you're a cost conscious consumer of healthcare, we'll talk about how accessing healthcare is cheap or no cost to you based on your insurance benefits. So digital allows us to engage more frequently. And Steve, I would just give an example that over 95% of our patients that are engaged in specialty pharmacy at CVS Health are engaged digitally. And that really helps us to make sure that patients who are getting some of the most complex medications to treat chronic conditions are getting that engagement digitally. So just to round out, digital helps with engagement. It then ultimately leads to improved care plan adherence, real-time data exchanges, seamless referrals, and it's just incredibly exciting about what we're doing on the digital side. I think the other area that you talked about is artificial intelligence, and it's incredibly exciting about what the opportunity is for artificial intelligence. And we have to also take that in a measured manner. And so if you wind the clock back a couple of years, there was something called clinical decision support, which is almost like an early version of artificial intelligence. And it was this set of data and analytics that would pop up in the electronic medical record to help providers, physicians, to make decisions on is this the right next step for care? When clinical decision support was rolled out, there was a lot of concern among physicians that this was ceding the ability of physicians to actually provide care to computers and to algorithms. And if you go to any physician's office today, everyone has clinical decision support, and you can't imagine providing care without clinical decision support there. Artificial intelligence is just the next step. It is going to make us as clinicians better in delivering care. And it's going to be in a couple of ways. One is going to be in helping us to identify what might be potential conditions or diagnoses, and that improving diagnostic capabilities is important. Another is, how do I make sure that once I've got that diagnosis, that I'm choosing the right treatment path? And that is just the next version of clinical decision support. But we also see in some other ways, which is when you leave that doctor's office, how can we use AI to keep people engaged, reaching out to them on a consistent basis through chatbots and through digital enhanced by AI to make sure that they understand what was discussed and how do you stay on therapy? Another way that we're using artificial intelligence is to reduce the burden that providers have in delivering healthcare. So there's a technology that we use right now in our clinics called ambient artificial intelligence. And so if I'm seeing a patient, historically, I'd have to be furiously typing down in a keyboard or writing on a pad of paper. My head is down, not looking to the patient who I'm interviewing or taking care of. With ambient AI, we have the ability to have our cell phones listen to the conversation so that I'm focused on the patient who's in front of me. And then at the end of that visit, you have a full note that's completely written out that summarizes the conversation. And it allows the provider, the physician, to have a much more personal relationship, not spending time typing on the computer, but that it allows you to have that more human connection and to pay attention to the details and the nuances of the patient's issues. So AI is not just improving how we diagnose and treat, but it's also improving the way that we interact and connect with our patients. And so I'm really excited about where we're headed with artificial intelligence.
Yeah, now just wrapping up then, we've talked a lot about demographics, age-based and geographic-based. We haven't talked about equity in access. Talk about what CVS Health is doing to try to improve equity in access.
Yeah, the way that I think about equity is that when we as physicians, or if you're on the health insurance side, we're looking to make sure that everyone has the opportunity to achieve the health outcomes that they want. And when you start to break down the data, you see geographic differences, you see racial or ethnic differences, you see economic differences. So the rural urban divide is an example. We talked about earlier that it's easier to access healthcare if you're in an urban setting versus in a rural setting. And by using data and analytics, we have the opportunity to understand where are there barriers, and then how do we need to then basically target and create programs that address those specific barriers to healthcare access. And it really is about flexible engagement channels, listening and adapting and empowering. So we have been using new data analytics that then help us to understand what are the disparities that we see in populations, and then having very targeted initiatives. And so we've taken a real focus to hearts and minds. And so cardiovascular health and mental health, and then understanding what are the drivers of disparities in achieving high blood pressure management, managing your depression, and then using that data and analytics to have specific community partnerships or the use of new workers to help address those disparities. So it's been very exciting. The way that I think about health equity work is that it's population health work using data and analytics, targeted interventions to make sure that we improve the health outcomes of the populations that we're serving.
Dr. Sree Chaguturu, thanks for being with us today.
Thank you. It's really a pleasure.
And thanks to all of you for listening to C-Suite Perspectives. I'm Steve Odland, and this series has been brought to you by the Conference Board.
You have been listening to C-Suite Perspectives, a podcast by the Conference Board.